to see you there. Heard you wanted to learn about congestive heart failure. I'm the right guy for you. I have a couple friends that I want to introduce you guys to. They will help you out with congestive heart failure.
Hey, what's up, guys?
Hey. Oh, hey, Hector. We're just talking about
Hey guys.
Hey.
So they want to learn about congestive heart failure. How about y'all introduce yourselves?
My name is Kevin.
Hi, I'm Trevor.
Hey, I'm Hector.
And I'm Jeremy.
And I'm John.
Okay, so now I'm going to go ahead and define congestive heart failure to you. So congestive heart failure describes the inability or failure of the heart to adequately meet the needs of organs and tissues for oxygen and nutrients. This decrease in cardiac output, the amount of blood that the heart pumps, is not adequate to circulate the blood returning to the heart from the body and lungs, causing fluid, mainly water, to leak from capillary blood vessels. This leads to the symptoms that may include shortness of breath and edema. So now I'm going to talk about congestive heart failure epidemiology. There have been specific genes and gene mutations that have been linked to the development of hypertension, coronary artery disease, and cardiomyopathy. These three cardiovascular disorders are known as risk factors for CHF. Cardiomyopathy, which is the common cause for CHF, may be attributed to at least 40 defective genes. African Americans have a higher incidence of CHF, develop CHF at an earlier age, and experience higher mortality rates related to CHF than whites. Other risk factors include older age, female gender, diabetes mellitus, and obesity. Okay, so now we're going to talk about geographical prevalence of congestive heart failure. The American Heart Association estimates that more than 650,000 new cases of CHF are diagnosed each year. It is the most common reason for hospitalization in adults over the age of 65. It is the largest health problem in the United States.
Hey, how you doing? I'm going to be talking about the relevance of CHF in the nursing community, clinical manifestations, and risk factors. All right, first we're going to talk about community relevance in the nursing student community. As nursing students, congestive heart failure is relevant to us because we are constantly in a state of stress while in school. We are constantly studying, staying up late, or busy handling personal issues that we often forget to de-stress and relax. We often throw exercise and meditation to the side and instead find negative coping mechanisms like overeating, procrastination. All these stress and overeating is detrimental to our heart and can lead to an overworked cardiovascular system that could in the future lead to CHF. Now we're going to talk about clinical manifestations. Heart failure can be an ongoing or an acute condition. Heart failure signs and symptoms may include shortness of breath, fatigue and weakness, swelling in your legs, ankles, and feet, rapid or irregular heartbeat, reduced ability to exercise, persistent cough or wheezing, increased need to urinate at night, swelling of your abdomen, very rapid weight gain, lack of appetite and nausea, difficulty concentrating and decreased alertness, sudden severe shortness of breath, and chest pain. Now we're going to talk about risk factors for CHF. A single risk factor may be enough to cause heart failure, but a combination of factors also increases your risk. Some risk factors may be high blood pressure, which causes your heart to work harder than it should be. Diabetes can cause high blood pressure and coronary heart disease that could then lead to signs of congestive heart failure. Alcohol and tobacco abuse, which can weaken heart muscles and increase the chance of heart failure. Obesity can lead to a harder working heart that can increase the chances of developing heart failure. Genetics that can lead to CHF due to structural heart abnormalities that people are born with. And sleep apnea, the inability to breathe properly at night, results in a low blood oxygen level and increased risk of abnormal heart rhythms, which can both lead to a weakened heart.
I'm going to tell you guys about diagnostic tests and complications of CHF. Diagnostic tests may include an electrocardiogram, echocardiogram, and cardiac catheterization. The purpose of these tests is to evaluate heart function and to detect coronary artery disease, heart attack, and valve dysfunction. There are many complications of CHF. The major complications of CHF, though, are pulmonary edema and AKI. Pulmonary edema is a medical emergency. It's an accumulation of fluid in the lungs. Failure of the left side of the heart causes blood to accumulate in the veins of the lungs, producing a dangerous rise in blood pressure within these veins. Sustained high pressure in the pulmonary veins eventually forces some fluid from the blood into the surrounding alveoli, which transfers oxygen into the bloodstream. As the alveoli fill with fluid, they can no longer provide adequate amounts of oxygen to the body. AKI can make your heart failure worse. Damaged kidneys cannot remove as much water from the blood as healthy ones. You'll start to hold on to fluid, which raises your blood pressure, and this high blood pressure can make your heart work even harder. CHF is not contagious, but
emotional distress for congestive heart failure. Congestive heart failure can be tough to those with a close relationship to the person affected in some way, either directly or indirectly. Congestive heart failure can be emotionally hard and can lead the family and the individual to depression. No matter what, spiritually, this disease is tough to deal with because the family and the individual are constantly thinking about their future. Family and friends can best provide support to the individual by learning about their heart failure and the individual's treatment plan. They can be particularly effective by helping the individual stay on top of their proper diet and encourage the person affected to increase his or her physical activity. The American Heart Association is the best support resource for individuals and families who are dealing with heart failure. American Heart Association helps people understand the importance of healthy lifestyle choices by eating right and stay active. Rehab services for congestive heart failures are long-term care facilities such as nursing homes.
Oh, hi guys. I'll be talking about treatment, prevention, and burden to the family. For prevention, do not smoke if you smoke and avoid secondhand smoking. Also, eat a heart-healthy diet, such as vegetables, fruits, fish, lean meat, and whole grains. Choose foods that are low in saturated fat and avoid trans fat. You want to limit sodium and alcohol and sugar, and you want to manage any health problems such as high cholesterol, hypertension, and diabetes. For treatment, two objectives in treating heart failure. One is to reduce the workload of the heart, and the other is to increase cardiac output. Treatment depends on the cause of heart failure, the type of heart failure, and the severity of symptoms, and how well the body is able to compensate. In early stages of heart failure, taking medications such as diuretics and ACE inhibitors may help heart failure and prevent other damages. ACE inhibitors dilate blood vessels and decrease systemic and vascular resistance, reducing the heart's workload. Patients who cannot tolerate ACE inhibitors can instead receive vasodilators. These increase cardiac output by reducing the impedance of ventricular outflow, which decreases afterload. Also making lifestyle changes such as eating less sodium and being more active may help heart failure and prevent other problems. Part of ongoing treatment for heart failure, your doctor may encourage in getting vaccines such as pneumonia and flu because infections increases the workload of the heart. He may also want you to monitor your daily weight, and remember, when monitoring daily weight, you want to use the same scale and check your weight at the same time every day. Financial burden to the family and patient in society. Cost of heart failure continues to rise. It's a heavy financial burden to the U.S. economy. Costs were approximately $31 billion in 2012. There is a cost for heart failure per patient of $110,000.
Yeah!
Jeremy, I can still see you.
Yeah!
Ooh, almost had it too.
Hold on, wait.
Hi guys.
Hey!
Hey, yo, what up? Talk to y'all about these diagnostic tests and complications of CHF.